All right, welcome back. So we're moving into section 3. Section 3 is going to be all about shoulders. This will be just like the previous sections. There's going to be 4 episodes. Today is going to be about bones and joints. Next week will be about muscles. Episode 3 will be about nerves and vasculature. Episode 4 will be about self-treatment and exercise that you can do for this region. So let's go ahead and jump into the bony anatomy here. We're going to take a look at the SC joint first. Why is it called that? It's where the sternum and the clavicle meet. So S sternum, C clavicle, clavicle, aka collarbone. Okay, this is kind of a forgotten joint, but we do need movement here. The way I like to think about the SC joint, picture the spoke on a wheel. Now you don't need that much movement. You don't need that much movement at the inside of the spoke, but a little bit of movement can yield a lot of movement out here at the other end of the clavicle where your AC joint is, and we're getting there. So even a small restriction at your SC joint could prevent overhead movement, retraction, protraction of your shoulder blades. So small joint, but still pretty important, okay? So let's cruise on out to the other end of our collarbone. That's where your AC joint is. There's a part of our shoulder blade called the acromion, okay? Scapula is a pretty interesting shaped bone. We'll take a look at it here. But that hook right there is called the acromion, and that's what meets your clavicle. So that's your AC joint. Now, when you hear about a shoulder separation, this is what we're talking about. If somebody falls, say on the tip of their shoulder, they stretch or tear some of these ligaments around that AC joint, and you can visibly see that collarbone lifted up. And it looks way worse than it is. These people usually recover without any kind of surgical intervention, just good strengthening around the area. It may be a little bit hypermobile there at the AC joint, but it's really not the end of the world. People usually do pretty well, okay? The next part of the shoulder complex is not a true joint, but we call it the scapulothoracic joint. What is that? That's your shoulder blade, and it's really just floating over your rib cage, your mid-back. So there's no true ligamentous or bony attachment, and that's why it's so crucial for us to have good control over these muscles. It's just floating there, okay? And then trace back through what we just talked about, AC, SC joint. SC joint is really your only true attachment of your shoulder complex to the rest of your body, okay? That's why we have so much freedom of movement around our shoulders, but the flip side of that is that they're just inherently unstable. So we got to make sure they're strong, okay? Let's keep moving on. We're going to take a look at the GH joint now. That is your glenohumeral joint. Gleno meaning glenoid, which is the socket part of our shoulder blade. H is the humerus, so it's just the top end of your upper arm bone that sockets into that. Now, we usually compare this to a golf ball on a tee rather than a ball and socket, because as you can see, it's very shallow. Now, we've got joint capsule, labrum, rotator cuff, all things that help keep that joint seated, in the socket as we move around. The bigger muscles are going to be what move us around, but that rotator cuff has a role in keeping, along with the labrum and the capsule, keeping that joint seated, okay? So very quick and dirty look at the bony anatomy and the shoulder complex, but it should give you a good idea of what's going on in there and make more sense out of the future episodes when we start talking about muscles, nerves, self-treatment, and exercise. So that's going to do it for today. Stay tuned for episode 2 of section 3 next week.